What if I told you that walking 10,000 steps a day won't stop you from falling? In fact, thousands of seniors who walk daily still lose the one type of strength that prevents falls, and most doctors never mention it. Stay with me for the next 10 minutes. This single chair exercise could save your life. Meet Margaret. At 68, she was the picture of health, or so everyone thought. Every morning at 6 a.m., rain or shine, Margaret walked 3 miles through her neighborhood. Her fitness tracker showed 12,000 steps daily. Her cardiologist praised her dedication at every checkup. Her friends at the community center envied her energy and commitment. She felt strong. She felt healthy. She felt invincible. Margaret believed she was doing everything right. After all, every health article, every doctor's recommendation emphasized the same thing. Walk more. Get your steps in. Stay active. Until one Tuesday afternoon in October. She had been reading in her favorite chair, the one by the window where the afternoon sun streams in. The phone rang in the kitchen. She stood up to answer it, the same movement she'd done thousands of times before. But this time, her legs simply gave out. No warning, no gradual weakness, just sudden, complete failure. She fell backward, her hip hitting the hardwood floor with a sickening crack. In the emergency room, surrounded by beeping monitors and concerned faces, her doctor said something that would change everything. "Margaret, your cardiovascular system is excellent. Your endurance is that of someone 10 years younger. But your leg power, your explosive strength, is at critical levels, and walking can't fix that. Walking will never fix that." She had been so focused on her step count, so proud of her daily walks, that she never realized she was training the wrong thing. The recovery was long. 3 months of physical therapy, weeks using a walker. The loss of independence was devastating, but it was what her physical therapist told her during rehabilitation that gave her hope. "Margaret, if you had been doing just one simple exercise, 2 minutes a day, that's all, this fall likely never would have happened. Your legs would have had the explosive strength to catch you." Today, 18 months later, Margaret does 10 chair power stands every single morning. She still walks her 3 miles, but now she trains power too. She hasn't fallen since. She can stand from any chair, any height, with complete confidence and control. This is Margaret's story, and it doesn't have to be yours. If you're over 60 and relying only on walking to stay healthy, you're making the same mistake Margaret made. You're training endurance while your power, the strength that prevents falls, silently disappears. In the next 15 minutes, I'm going to show you exactly what to do about it. Let's talk about why walking alone isn't enough. Walking is one of the most recommended exercises for seniors, and I want to be absolutely clear. Walking is wonderful. It's one of the best things you can do for your health. Walking improves cardiovascular health, strengthens your heart, lowers blood pressure, helps control blood sugar, supports weight management, improves mood, reduces stress, and requires no special equipment or gym membership. These are all tremendous benefits, and I encourage everyone to walk regularly. But, and this is critical, while walking builds endurance, it does very little to maintain muscle power. And that difference? It's literally the difference between staying on your feet and hitting the ground. Let me explain something most doctors never take time to clarify. Muscle strength and muscle power are not the same thing. Muscle strength is how much force you can generate. Think of it as the total amount of weight you can lift or push. This declines gradually with age, about 1 to 2% per year after age 50. Muscle power is how quickly you can generate that force. It's the combination of strength and speed. Think of it as explosive strength, the ability to react instantly. And here's what changes everything. Muscle power declines much faster than strength, 3 to 4% per year. By the time you're 70, you may have lost 60% or more of your muscle power, even if you stayed relatively active. Strength, -1 to -2% per year. Power, -3 to -4% per year. Think about when power matters in your daily life. You trip on an uneven sidewalk. You have a split second to catch yourself before falling. You're crossing a street and the light changes. You need to speed up quickly to reach the curb safely. You're standing from a low chair or toilet. Your legs need to generate enough force to lift your body weight rapidly. You're carrying groceries and start to lose your balance. Your legs must react instantly to stabilize you. You're climbing stairs and your foot slips. You need explosive strength to recover your footing. Every single one of these situations requires your muscles to contract powerfully and quickly. That's power, not strength, and certainly not endurance. When you walk, you're moving at a steady, moderate pace. Your muscles contract repeatedly but slowly. You're training endurance and some strength, but you're not training explosive power at all. A landmark 2014 study published in the Journal of Gerontology, Medical Sciences, analyzed over 500 community-dwelling seniors who walked regularly. We're talking 10,000 or more steps every single day. These weren't sedentary people sitting on couches. These were highly active seniors doing exactly what their doctors recommended. The researchers measured their cardiovascular fitness, excellent. Their endurance, excellent. Their daily step count, excellent. Then they measured leg power. Average daily steps, 11,247. Cardiovascular fitness, above average for age. Walking endurance, excellent. Leg power, declined 30% over 5 years. The researchers ran extensive statistical analyses and found something shocking. Daily step count explained only 3% of the variance in muscle power among older adults. Translation? Walking has almost no relationship to maintaining leg power. You can walk 5,000 steps or 15,000 steps. Your muscle power will decline at roughly the same rate if that's all you're doing. This wasn't a one-off finding. Study after study confirms the same thing. A 2012 study in Age and Aging, a 2015 study in the Journal of Applied Physiology, a 2018 review in Sports Medicine, all reached the same conclusion. Steady-state aerobic exercise like walking does not prevent the age-related decline in muscle power. And those consequences? They're severe. 1 in 4 adults over 65 falls each year. CDC. Falls are the leading cause of injury-related death in seniors. 300,000 hip fractures annually in the U.S. 95% of hip fractures are caused by falling. 20% of hip fracture patients die within 1 year. But here's what gives me hope. Research shows that most of these falls are preventable. The loss of muscle power isn't inevitable. You can reverse it if you train it specifically. The American College of Sports Medicine, the National Institute on Aging, the American Geriatric Society, all now emphasize the same critical message. Seniors must incorporate power training, not just aerobic exercise. And the simplest, safest, most effective way to train power? It doesn't require a gym. It doesn't require weights or equipment. It requires one piece of furniture you already have, a chair. Before I show you the exact exercise, let me explain the science of why this works, because understanding the why will help you do it correctly and stay motivated. To understand why the chair power stand works and why walking doesn't, you need to understand what's happening inside your muscles right now. If we could zoom into your leg muscles, we'd see thousands of individual muscle fibers bundled together. And those fibers come in 2 distinct types, each with a completely different job. Type 1. Slow twitch fibers. Slow twitch fibers are your marathon runners. They're red because they're packed with myoglobin, oxygen-carrying proteins that give them endurance. Used for prolonged, steady activities. Walking, jogging, cycling, standing for long periods, high resistance to fatigue, contract slowly but can keep going for hours. Decline rate, 1 to 2% per year after age 50. When you take a 30-minute walk, these are the fibers doing most of the work. They're perfect for endurance, and walking keeps them in excellent shape. Type 2. Fast twitch fibers. Fast twitch fibers are your sprinters. They're white because they rely on quick energy sources rather than sustained oxygen. Used for explosive, rapid movements, standing quickly, jumping, catching yourself, quick reactions. Fatigue quickly but generate massive force. Contract 3 to 5 times faster than slow twitch. Decline rate, 3 to 4% per year after age 50. When you need to stand up quickly, catch yourself from stumbling, or climb stairs rapidly, these are the fibers that save you. The critical difference. Think of it this way. Slow twitch fibers are like a fuel-efficient sedan, great for long distances, steady speeds. Fast twitch fibers are like a sports car, explosive acceleration when you need it. You need both. But for fall prevention and functional independence, fast twitch fibers are your lifeline. The aging problem. Here's where aging changes everything. As you age, both fiber types decline, but at dramatically different rates. By age 70, slow twitch loss, approximately 20 to 25%. Fast twitch loss, approximately 40 to 50%. You're losing fast twitch fibers at twice the rate of slow twitch. And those fast twitch fibers? They're exactly what prevents falls. Why walking can't fix this? When you walk at a normal pace, you primarily activate slow twitch fibers. The movements are too slow, too steady to recruit fast twitch fibers significantly. Research using electromyography, EMG, which measures electrical activity in muscles, shows that walking activates fast twitch fibers at only about 20 to 30% of their maximum capacity. That's not enough stimulus to maintain them, let alone build them. Why explosive movements work? But when you perform an explosive sit-to-stand, rising as quickly as possible, everything changes. The rapid acceleration required forces your nervous system to recruit fast twitch fibers at 80 to 90% of maximum capacity. The same research found that explosive resistance movements activate fast twitch fibers up to 400% more than steady-state aerobic exercise. The neural component. There's another critical component, the neural pathways between your brain and muscles. These pathways determine how quickly your brain can send the "contract now" signal to your legs. Power training doesn't just maintain muscle fibers, it maintains and even improves the speed of these neural signals. Think of it as keeping the electrical wiring in your body responsive. Research shows that neural conduction velocity, the speed signals travel, slows with age. But explosive power training can partially reverse this decline, improving reaction time and coordination. So when you do explosive chair stands, you're addressing three critical factors: maintaining fast twitch muscle fibers, training neural pathways for quick reactions, teaching your body to generate force rapidly. Walking can't do any of these things, but a simple chair can do all three. Let me show you exactly how. The chair power stand is remarkably simple, but technique matters. Let me walk you through every step. Equipment you need: one sturdy, non-rolling chair, no wheels, flat, non-slip surface. Optional, support rail or wall within arm's reach. That's it. No gym, no special equipment. Step 1. Setup. Sit on the chair with your feet flat on the floor, hip width apart. Your knees should be at roughly 90 degrees. Position your feet slightly behind your knees. This gives you better leverage. Keep your chest tall, shoulders relaxed. Your hands can rest lightly on your thighs. Advanced practitioners can cross arms over chest, but beginners should keep hands available for balance, not to push off. Step 2. The explosive stand. Here's where power training happens. Lean slightly forward from your hips, not your back, and stand up as quickly and safely as you can. The speed is critical. This is what activates those fast twitch fibers. You're not casually standing, you're exploding upward. Drive through your heels, engage your glutes and quadriceps powerfully. If you're comfortable and balanced, rise slightly onto your toes at the top. Stand fully upright. Squeeze your glutes at the top. Hold for 1 second. Step 3. The controlled descent. Now comes the part most people rush, but this is just as important as standing up. Lower yourself back to the chair slowly. Take 3 to 4 seconds. Control every inch of the movement. This eccentric contraction, muscles lengthening under tension, builds tremendous strength. Don't just drop into the seat, ease down with control. Lightly touch the seat, then immediately begin the next repetition, or rest briefly if needed. Step 4. Repetitions and frequency. Starting recommendation: 5 to 8 repetitions per set. 1 to 2 sets per day, 3 to 5 days per week. Rest at least 1 day between sessions initially. As you get stronger, typically after 2 to 3 weeks, increase to 10 to 12 reps per set. Add a second or third set. Increase to 5 to 6 days per week. Clinical studies show that seniors performing explosive sit-to-stand exercises just 3 times per week for 12 weeks reduce their fall risk by 38%. The American Council on Exercise and the National Institute on Aging both endorse this movement as one of the most effective power exercises for older adults. What this exercise improves: leg power and explosive strength, balance and coordination, reaction speed, functional independence, fall prevention. Before you attempt even one repetition, we need to talk about safety. This exercise is safe for most adults, but there are important precautions and some people who should consult their doctor first. Medical clearance required if you have recent hip, knee, ankle, or back surgery within 6 months, severe osteoarthritis or chronic joint pain, diagnosed balance disorders, vertigo, or inner ear problems, uncontrolled high blood pressure above 160/100, heart conditions requiring medical clearance for exercise, history of falls in the past 6 months, recent fractures or bone injuries, severe osteoporosis, T-score below -2.5, neurological conditions affecting balance, Parkinson's, MS, stroke recovery. If any of these apply to you, please, and I cannot stress this enough, show this video to your doctor or physical therapist. They can assess your individual risk, may modify the exercise for your needs, or may suggest starting with physical therapy first. This isn't meant to scare you, it's meant to protect you. Most people can do this exercise safely, but your doctor knows your complete medical history in ways I never could. Setting up your exercise space. Use a sturdy, stable chair. No wheels or rolling base, no swivel mechanism, preferably with some weight to it. Height where your knees are at 90 degrees when seated. Firm seat, not soft cushions that sink. Clear, non-slip flooring. Remove any rugs or mats that could slip. Ensure floor is dry. Never exercise in socks on smooth floors. Good lighting so you can see clearly. Sturdy support within arm's reach. Wall, countertop, heavy table, or railing. Not a light chair or furniture that could move. You won't always need it, but it must be there. During exercise, safety rules. Start slowly. Speed increases as strength builds, not on day one. Keep support nearby, within arm's reach at all times. Stop if you feel sharp pain. Muscle burn is normal, joint pain is not. Never exercise when dizzy, fatigued, or unwell. Breathe normally. Never hold your breath. Wear supportive footwear. Non-slip shoes, never socks alone. Stay hydrated. Drink water before and after exercise. Recognizing warning signs. Green, normal sensations. Continue exercising. Muscle fatigue or burning sensation in thighs. Feeling worked or slightly breathless. Mild muscle soreness the next day. Should decrease with time. Increased heart rate during the movement. Yellow, caution signs. Slow down or take a break. Excessive shortness of breath, feeling lightheaded or slightly dizzy, unusual fatigue, cramping in leg muscles. Red, stop immediately, do not continue. Sharp stabbing pain in any joint, knee, hip, ankle, back. Severe dizziness or loss of balance. Chest pain, pressure, or discomfort. Sudden severe shortness of breath, nausea, visual disturbances. If you experience any red warning signs, stop the exercise immediately and consult a healthcare provider before resuming. These could indicate an underlying issue that needs attention. Know the difference: discomfort versus pain. Normal discomfort, safe to continue. Burning sensation that builds gradually. Muscle fatigue that improves with practice. Feeling worked but stable. Soreness that's symmetrical, both legs equally. Abnormal pain. Stop immediately. Sharp, sudden stabbing sensations. Pain that worsens with each repetition. Pain that's asymmetric, one side only. Joint popping or grinding with pain. Pain that persists after you stop. Listen to your body. It's trying to communicate with you. Discomfort is feedback. Pain is a warning. Learn the difference, and you'll exercise safely and effectively for years to come. You've just learned something that most doctors never teach, and most seniors never discover. You know why muscle power matters more than step count for fall prevention? You know exactly how to train it. Now you have a choice. You can watch this video, think, that's interesting, and go back to your usual routine. Or you can stand up right now and do 3 reps. 1 chair, 1 movement, 2 minutes a day. That's all it takes. Margaret, the woman from the beginning, she made that choice. She hasn't fallen since. She stands with confidence. She lives independently. You can too. Thank you for watching. If this video helped you, hit that like button and subscribe for more evidence-based health strategies for seniors. Remember, aging is inevitable. Decline is optional. Take control of your strength, your balance, and your independence starting today. I'll see you in the next video.